What if I told you that a virus you've probably never heard of just triggered airport alerts across Asia, and the World Health Organization is officially involved? Yeah, this is not a movie trailer. This is real life. Before we jump in, smash that like button, subscribe to Alvan Global, and turn on notifications because this channel brings you global news without the boring stuff. If the world is shaking, we're talking about it. Now, let me ask you something. How dangerous does a virus have to be for multiple countries to go on high alert after only 2 confirmed cases? Stay with me. The World Health Organization has just confirmed a Nipah virus outbreak in India, specifically in West Bengal state. Only 2 cases so far, but don't let that number fool you. According to WHO Director General Tedros Adhanom Ghebreyesus, Nipah is a rare but serious disease. And when WHO uses the word serious, that's your cue to sit up straight. Here's the twist. Both cases involve healthcare workers, a female and a male nurse from Barasat, who started showing symptoms in late December and were hospitalized in early January. Healthcare workers getting infected is never just another detail. It's a red flag. And this is where things start to get interesting. So what exactly is Nipah virus? Think of it as a zoonotic virus, meaning it jumps from animals to humans. Its favorite carriers? Fruit bats, also known as flying foxes. Cute name, very uncute consequences. These bats are common across India, Southeast Asia, and parts of Oceania. The virus can spread through contaminated food, raw date palm sap, yes, really, and close contact with infected people. And here's the scary part. Human-to-human transmission is possible. This isn't new either. Nipah first appeared in Malaysia in 1998, and since then it's popped up in Bangladesh, India, Singapore, and the Philippines. So the virus isn't new, but the concern is. Why? Because of this next detail. Nipah virus has a case fatality rate of 40 to 75%. Let that sink in. That means up to 3 out of every 4 infected people may not survive. And here's the kicker. There is no licensed vaccine, no specific treatment, no miracle pill. Prevention mostly relies on awareness and behavior change. Now, because of this outbreak, the WHO and Indian health authorities are monitoring over 190 people who had contact with the infected nurses. Meanwhile, countries like Hong Kong, Malaysia, Singapore, Thailand, and Vietnam have already tightened airport screenings. So no, this isn't panic, this is preparedness. But the real question is this enough? Let's be clear, there are no linked cases outside India right now. That's the good news. But here's the not-so-comfortable truth. Global travel means viruses don't need passports, and outbreaks don't announce themselves with a countdown timer. The WHO says this outbreak is linked to bat activity and cultural practices, which means controlling it isn't just medical, it's social, environmental, and behavioral. And history has taught us something very important. Big outbreaks often start very small. Which brings me to the part nobody is talking about enough. What happens if one infected person slips through airport screening? What happens if symptoms appear late? Remember, Nipah's symptoms can take up to 14 days to show. Fever, headache, muscle pain, vomiting, sore throat. Sounds like the flu, right? And that's exactly why it's dangerous. By the time people realize it's not just a flu, it might be already too late. Now, I'm not saying this to scare you. I'm saying this because information is protection. Right now, health authorities say the situation is under control. But here's the thing. They're still monitoring contacts. Airports are still on alert. And the virus hasn't said its final word. So the real question is, will this outbreak end quietly? Or is Nipah about to remind the world why WHO is watching so closely? That's a story we're tracking in real time. If you want updates before they hit the headlines, subscribe to Alvan Global, like this video, and share it because someone else might need to hear this. I'm Alvan, and until next time, stay informed, stay curious, and stay safe.